Wales and Victoria have removed close contact isolation requirements. Joining us with some reaction is the Australian Medical Association President, Dr. Omar Khorshid. Dr. Khorshid, appreciate your time. Is it the right call to be doing this, to lift those household contact isolation requirements?
Well, the Chief Health Officers have previously said that this is a step Australia needs to take as we come down from the peak of this Omicron BA2 outbreak that we've had around the country. Now, of course, each state is in a different place, but for New South Wales and Victoria, they do seem to be declining in case numbers. So it's reasonable, as long as the Chief Health Officers are advising it, to take these small steps at normalising COVID-19 into our community, but while still protecting our hospitals and our vulnerable in the community.
Plenty of people will be relieved, business owners, chief among them, but what impact do you expect these easing of restrictions will actually have on case numbers?
Well, we are likely to see an increase in case numbers, but of course it's not a complete free-for-all. There are still some reasonable expectations of each individual that we're now going to a situation where we've all got to take responsibility to do the right thing ourselves. If you've been exposed, to, of course, get that daily RAT test and to wear masks if out and about, and of course to avoid high-risk locations like hospitals and aged care facilities. So if everyone's doing the right thing, then of course we'll see a smaller rise in numbers than we would have seen if everyone just takes this as carte blanche to forget about COVID and think that the pandemic is over.
Vaccination's obviously a key plank of the strategy. How is our vaccination program progressing? Are we seeing that those who are eligible for boosters are going out and getting them?
So, of course, our booster rate is not as high as our second dose rate anywhere in the country. And in fact, that's the case all over the world as well. And in particular, in places like New South Wales, where there was a very substantial Omicron outbreak, a lot of people have actually had the virus, and I suspect they don't feel the need to go and get the booster. The strong message is the booster is still required. It will actually improve your chances of avoiding the next version of COVID that comes along, of staying safer for longer, and of course, for protecting those around you. And of course, the other vaccination message as we come into winter is that all Australians should avail themselves of the flu vaccine, because of course the flu is another virus that could, in rare cases, mean you end up in hospital, could further increase the burden on our hospitals. And if everybody goes out and gets the flu vaccine, we're going to have a much better winter than if we don't, and our hospitals are again struggling under a huge burden of both COVID and flu this winter.
Just back to the booster jabs, what does the latest data tell us about their protection and when it does start to wane, in terms of telling those people who are perhaps on the fence about whether or not they need to get it? What is the data as to how long their last jab will last for?
So the data's hard to interpret, and it's pretty complex. So I think we've got to go back to the recommendations that come from the experts. We do know that the actual antibody levels do fall after the booster dose and after you've had an infection as well. But of course, there's another type of immunity that is there in the background, and we just don't know how effective that is in the long term, and whether in fact fourth and fifth doses will be required for the average population into the future. So for now, the simple message is follow the advice of the experts, and the experts are saying 3 doses for everybody in the community and 4 doses for those who are vulnerable, because there is that boost in immunity. Each time you get a vaccine, those antibody levels do go up, and those antibody levels provide a meaningful increase in protection, particularly for those who are vulnerable in the community.
No doubt you're currently lobbying both sides of politics during this federal election campaign period. So far, how are they going? Are either side doing better, do you think, in terms of commitments they've made thus far on the health front?
So unfortunately, we've not seen much at all in health from either side so far in the election. It's still a battleground that is completely open for either side to win. The government seem to be sitting back on their performance during the pandemic and saying that health's pretty much okay. And of course, we haven't heard a lot from the opposition as yet. We've heard a policy that the AMA has got significant concerns about in terms of urgent care centres, which we don't believe are going to provide the solution to either hospitals or to general practice. And we're speaking to both and saying there really is a need for change here. Sitting back and saying we're not cutting Medicare is not good enough. If you want to be the friend of Medicare, you've actually got to invest in it, to invest in Australia's health. And we're really looking forward and hoping that one party or the other will take the lead on health because it's something that we know is important to voters, and it'll be a very significant issue when it comes to polling day.
Dr. Omar Khorshid, appreciate you joining